All right, lads, you've asked, and I'm going to answer. What the hell is TRT? Well, the letters itself stands for Testosterone Replacement Therapy. And what actually is that? Testosterone replacement therapy is you taking supplemental testosterone to boost up your own low levels of testosterone. Testosterone is kind of known as the holy hormone. It is what makes you a man. It's the essence of being a man. It's responsible for your mood, your energy levels, your mental sharpness, your ability to control your body weight, whether you want to build muscle or lose fat. Also your libido, strong boners, and also your overall well-being. If you're generally not feeling good, this could be an indicator that your T levels are low. But Damien, if I'm taking testosterone, am I not doing what the bodybuilders are doing? This is the thing that you got to understand. TRT is therapeutic levels of testosterone. It's far, far different to what bodybuilders would be at. Let me explain. If you're to go on TRT, you're going to be taking small quantities of really high quality compounds. Whereas if you're a bodybuilder that's working off the black market, you're taking large quantities of who knows the fuck what. There is a massive difference between what you would do for TRT and what you would do for bodybuilding. Also on the topic of bodybuilding, if you are using high levels of hormone, it comes along with a lot of side effects. Some of them might be high blood pressure, high resting heart rate, terrible sleep because your HRV drops down. You put a huge amount of stress on your nervous system, on your entire system actually. There's hair loss, there's acne, and there's also, if it's used excessively, erectile dysfunction. So when you go on TRT, you're actually working directly with a doctor to make sure he's getting the right dosage for you. So how do we figure out where your testosterone level is actually at? Well, there's all the symptoms that might be associated with low testosterone. For example, low energy, low drive, no motivation, always tired, always injured, and you struggle. You have this overwhelming feeling that you're not quite yourself and you just don't feel good all of the time. This could be mistaken as depression, and it sometimes is. But the only true way to figure out what's going on is by blood testing and testing your hormones specifically. So what do you do when you get your blood tested and you figure out your levels are low? Well, step number one is you start improving your lifestyle. Are you getting a good quality sleep? Are you eating good quality food? Are you exercising? Are you taking the right supplements like vitamin D and magnesium to make sure you're doing everything you can possibly do to ensure that you're living the correct lifestyle to produce good testosterone? Is there excessive alcohol? Is there a lot of stress? And are you managing those things? Now, if you're doing all the lifestyle things correctly and you still need a supplemental intervention, well then working closely with a doctor, they can monitor your levels and prescribe the exact amount that you should be on. And this is what I would recommend for anyone moving forward with TRT, that you work under the guise of a doctor. So the next question is, so what age do I need to be in order to use testosterone replacement therapy? Well, nowadays you have guys of all ages. Not just older guys, you have younger guys as well. Because in the last 20 years, the research has shown a massive decline in testosterone in the younger generation. And this might be for a number of reasons, but it's seen and it's showing up in blood work. So you have a lot of younger guys now using it because maybe they're showing up a lot of symptoms and maybe they're not just feeling themselves. So rather than going on something like an SSRI, which is an anti-depression medication, they're actually going for the hormone replacement therapy, which doesn't block how they're feeling with as an SSRI would, but it allows them to be themselves and allows them to get back their energy and drive, which actually helps them in life. But understand this, that embarking on the journey with testosterone replacement therapy, it's kind of a lifetime commitment. Once you go down it, your own production of testosterone reduces and over a long period of time will shut down completely. So this needs to be factored in to what age you're at. If you've had kids already, maybe if your own testosterone level shuts down, your production of sperm also reduces. And if you've already had kids, that might not be a factor. But if you're a young man, let's say 20, 21, 22, this needs to be seriously considered before you would undergo TRT. And following on from that, so what can you do if you are thinking about TRT and if you are very young? Well, you need to freeze your sperm. It's that simple. You go to a fertility clinic, get it frozen so you have it there, because the likelihood of your own production stopping is very, very high. And what can I do before I would consider using testosterone replacement therapy? Well, as I've spoke earlier on, it's a lot about your lifestyle. Are you getting enough sleep at night? That's probably the biggest one, because while you sleep at night, that's when your brain produces testosterone and replenishes what's lost. So if your sleep at night isn't good quality, you can be sure that your testosterone is down low. Also, eating regularly and eating the right amount of calories for you. Eating plenty of red meat, spinach, oranges, those are my kind of SOS things that people should be eating on a regular basis to help produce good testosterone. And also exercising, getting into the gym, lifting weights. It's a funny thing that when you're in the gym, you actually reduce the amount of testosterone that's produced, but afterwards, after exerting your body hard, you get a spike in testosterone 24 to 48 hours after. So it's important that the lifestyle that you have is conducive to producing good testosterone. And also toxins like smoking and drinking alcohol, they're also kind of have a very negative effect on your production of testosterone, because they interrupt sleep cycles, they interrupt your appetite, they stop you from training, they stop you from exercising. So they all these things factor in. So having a good lifestyle will be super important. And in a lot of cases, when someone starts fixing their lifestyle, their own natural production of testosterone starts to increase. And the thing that is important about that is, if you have low testosterone, you don't need huge amounts of it to make a change. You just need to uptick it by a couple of points to make a massive difference in your overall well-being. So to wrap this up, I believe to talk about testosterone replacement therapy is very important. As men grow older, they hit a thing called an andropause. Now it's probably your very first time hearing that word, but in women the equivalent would be a menopause. So as men hit the age of 30, their T levels automatically start to decline. But there's nothing done about this. Whereas this starts to happen to a woman, and there's hormone replacement therapy available for them. So it's my job to start this conversation. And if you want to know more about this, please don't hesitate to reach out and send me a DM and ask for more help, because I have clinics where I can send you to do your bloods. I have doctors that I work with that can actually advise you more on what you need to do. And of course, my role as a coach is to do the lifestyle things, help you with your sleep, your time management, your stress levels, your training, and of course, your nutrition. So don't be afraid to reach out. I'm here to help you. Giddy up!